Let's talk about digital health. It's this huge, exciting world that promises to completely change medicine for the better. But let's be honest, it can also be incredibly confusing. It feels like this giant landscape just cluttered with buzzwords and different technologies.
So, the big question is, how do we make any sense of it all? How does the health minister in one country, a software developer in another, and a nurse on the front lines, how do they all speak the same language when we're talking about tech and healthcare?
I mean, you hear all these terms thrown around, right? Things like telemedicine.
And mHealth.
You've got wearables, DHRs. And when everyone's using different words for the same things, or the same words for different things, it's impossible. You can't plan, you can't invest wisely, and you sure can't build systems that actually talk to each other. What you end up with is just a whole lot of confusion.
But what if there was a way to cut through all that noise? Turns out there is. The World Health Organization created something that's basically a Rosetta Stone for digital health. It's a classification framework, a shared language that finally gets everyone on the same page.
And the core idea behind it is actually pretty simple. The WHO breaks down the entire complex world of digital health into these fundamental building blocks. They call them digital health interventions. And each one is just a single, specific thing that technology can do, like send a reminder or track medicine. That's it.
Okay, so here's how it works. It's this really powerful three-step logic. First, you start with the why. What's the actual health problem you're trying to solve? Then, you figure out the what. Which of those building blocks, those interventions, is the right tool for the job? And only then you get to the how. What kind of app or system is going to deliver it?
Now, theory is great, but let's make this real. Let's look at a real-world example, something that pretty much every family can relate to: making sure babies get their vaccinations on time. So, in the WHO's language, the health system challenge is called loss to follow-up. But we all know what that really means, right? New parents are exhausted, they're overwhelmed, and it's just so easy to forget a doctor's appointment. The goal is super clear. We want timely vaccinations for healthier kids.
So what's the digital fix?
Well, the framework points us to a very specific digital health intervention: transmit targeted alerts and reminders. See, it's not about some shiny, complicated new technology. It's about using a simple, proven tool to solve a very human problem.
And here's exactly what that looks like in the real world. A simple text message. We've all gotten them. It's a tiny little nudge that can make a massive difference in protecting a child's health. It's practical and it works.
And this is where the magic of the framework really shines. It connects all the dots. You start with a challenge, parents missing appointments. That leads you to the intervention, sending reminders. And that intervention is delivered by a specific application type. In this case, a simple communication system. Now, a government knows exactly what to invest in and what problem it's going to solve. That's huge.
Okay, so that's the patient side of things. But let's flip the script. What about the people on the other side of the equation? The doctors, the nurses, the people actually delivering the care. A massive challenge for any health system is making sure that all providers are using the most up-to-date medical guidelines. The WHO calls this poor adherence to guidelines. And you can imagine, in a chaotic clinic, it's just really hard to remember every single step for every possible condition. The goal here is consistency, making sure every single patient gets the best possible care.
So the framework offers these great digital job aids, things like an intervention to provide a checklist, or one that provides prompts and alerts. These act like a digital co-pilot or a safety net, just gently guiding the health worker to make the right call at the right moment.
Now, what's really interesting is how this connects to a more sophisticated type of application. The challenge of sticking to guidelines is tackled by an intervention like a digital checklist, and that is delivered through a more advanced application type, a decision support system, which might be built right into a patient's electronic health record.
Okay, so we've covered patients and we've covered providers. Let's zoom out one more time to the biggest piece of the puzzle: managing the entire health system itself.
A nightmare scenario for any health system is an insufficient supply of commodities. Plain and simple, that means a clinic has run out of vital medicines. This isn't just an inconvenience, this can be a life or death problem. So the goal is to get medicines where they need to be, when they need to be there. No exceptions.
And digital tools can tackle this head-on. By using interventions that can notify stock levels and manage inventory, health managers can literally watch their supply chains in real time. They can spot a potential shortage and fix it long before a shelf ever runs empty.
Now, this requires a very specific, purpose-built kind of application. You can't just use any old app for this. The problem of stockouts is solved with interventions like inventory tracking, and those are delivered through what's called a Logistics Management Information System, or an LMIS. This is literally the digital backbone of the entire medical supply chain.
So, we've seen how this framework helps patients, providers, and planners. But let's zoom out one last time. Why does having this shared language matter so much for the future of global health?
Well, the payoff is absolutely huge. When everyone's speaking the same language, you get much smarter planning and investment. You stop wasting money and effort, so you don't have 5 different groups all building the same reminder app. It lets researchers actually compare what's working and what's not across different countries. And maybe most importantly, it's the only way we can build systems that actually work together, that are interoperable, creating a truly connected health system that's smarter and fairer for everyone.
This framework is an incredibly powerful tool for right now, but it also leaves us with a really important question.
Let's talk